welcome to this tutorial. In this session, I'm going to show you the perfect way of meeting Nmcz standards in terms of essay writing. Okay, so in this video, we are basically going to focus on the following objectives. The first objectives, I want you to understand how to give definitions to meet Nmcz standards. Many at the time when you're asked to define a condition or anything and it's given 5 marks, I want you to attain knowledge on how to precisely define in order for you to be awarded 5 marks. But the second objective is a student should know general management of a patient as well as nursing management of the patient. So many of the time when Nmcz will ask you to generally manage a patient, and they can specifically tell you to manage a patient, just the specific nursing management. Okay, so I'm going to teach you the both approaches on these two for you to perfectly get the 50 marks that you deserve. And the third point, a student should know how to manage normal conditions as well as infectious conditions. So this video is also there to cater on helping a student to know how to manage normal conditions as well as infectious conditions. So there are conditions that can spread and there are conditions that are just there for one particular person. So you as an Nmcz candidate and someone who is writing their competence exams ready for work, you should be able to know the management of these two different conditions. And our first, but not our last, but not the least, a student should be fully equipped on the best approach to passing Nmcz exams. I'm also going to give you brief guidance on how best you can do to make sure that you clear your Nmcz exams on the first attempt. Okay, so now I have a simple question here that is going to act as a guide from Nmcz past papers so that we specifically see how best we can help ourselves. So this is a pediatric question. Let me read and please follow carefully. Baby Bibusa is 2 weeks old, born from a 16-year-old Kashimbi. Bibusa was born on the way to hospital because her mother started off late from Kamaramba where they live. On admission, Bibusa presented a high body temperature and you notice some foul smell, probably from the umbilical stump. The parents explained that they used a knife that they carried from home in case they were attacked on the way to cut the cord. A possible diagnosis of neonatal tetanus is made. I'm done reading the scenario. Now, I said I'm going to give you proper guidance on how best possible way you can pass an Nmcz. So with Nmcz exams, they are training someone in preparation for them to start working. So they want someone to be fully equipped of what they are doing. Therefore, one important thing you should keep in mind is whenever you are reading questions, pay attention to each and every detail. So here, in the management of this PEP, what are we going to pay attention to? We are going to pay attention to how old the child is, because there are different managements and there are different interventions that you are going to do depending on age differences. So one thing in pediatrics is you should take note of the age. How old is the baby? So that whatever intervention, or even if you're asked to say, state the management or general management, you should know what investigations can be done on a 2 weeks child, what kind of food the 2 weeks child can feed on, just like that. So this is basically very much important. It's very much important that you take note of that. You should also pay attention on the method that they use to cut the umbilical cord, because it's also giving you glimpse of what should follow. Okay, even in the management, we can also do that. So the diagnosis of neonatal tetanus has been made. Now the question is, define neonatal tetanus. I know you might have all the definitions that are around there, but according to Nmcz standards requires you to meet some certain levels of understanding when you are defining something. Okay, so whenever you are defining a condition, these things should never miss out in your definition. What's the first thing? The first thing is the system. This system, we are basically describing of this condition, what system has it affected? The second one, what is the causative agent? Okay, causative agent, or what is the cause of this particular condition? And then in your definition, you should also include some signs and symptoms, at least 3. Okay, minimum should be 3. When you reach 3, this is the standardized way of Nmcz. So now, remember, I've said the system, the causative agent, or it could be causative organism or any cause, and then you also include in the signs and symptoms. So now, let me define neonatal tetanus according to the outlined principles that I've given you, just provided now. So how do we define neonatal tetanus? So neonatal tetanus, I can define this way following the Nmcz standards. I can define to say that neonatal tetanus is a pediatric infectious condition which affects the central nervous system. I've mentioned the system. Caused by bacteria Clostridium tetani. I've mentioned the causative organism. Characterized by body rigidity, fever, and painful muscle spasms. I've mentioned 3 symptoms. Okay, I hope you are following. So now let me completely define what I've said. Neonatal tetanus, this is a pediatric infectious condition which affects the central nervous system caused by a bacteria, Clostridium tetani, characterized by body rigidity, fever, and painful muscle spasms. I've defined what neonatal tetanus is. Okay, that definition is going to automatically reward you 5 marks. So it's not just a matter of you defining, follow the order. Okay, follow the order, system, causative, signs and symptoms. Then you are well and good. Let's go to B. B says, describe the current immunization schedule in Zambia. Mentioning the vaccine, the disease it prevents, the route when it is given, the interval and dose. The instruction there is use sentences, no diagram. So the second thing I also want to mention, apart from paying attention to the scenario and paying attention to each and every detail, the situation here is telling us that we are not required to use any diagram. We are just supposed to use what? We are supposed to use the sentence. So on the use of sentence, meaning that you're just going to write all the vaccines, okay? The diseases prevents, the route when it is given, and the interval including the dose. You should not miss out any information on one particular vaccine here. Okay? You should not miss any important information here. So, for example, when you are writing this, the current immunization schedule in Zambia, or we want you to mention the vaccine, the disease it prevents, the route when it is given, meaning the age, the interval, if at all, in case of there are 2 doses, when do you give the next? That is the interval. And then we have the dose. Okay. So for example, I can give an example on what we call there's what we call BCG. So on the BCG, you want to actually write this information on BCG. I'm just going to give an example on one so that you know how to write it. Okay, and mention all the available vaccines so that you research on them and you are fully equipped with the information. So now let's start with BCG. BCG is you should be writing in full. So what is BCG? BCG is Bacillus Comte Guerin. So this is BCG. What does it prevent against? That is the disease. It prevents against tuberculosis. Okay. So it prevents against tuberculosis. The route of BCG is intradermal. Okay, meaning you just give below the skin. Okay. When is it given? It's given at birth. Okay. It's recommended mostly at birth. And on the interval, it's new because BCG is only one dose. Okay. And the dose for BCG is 0.05 milliliters. Okay, so the way I've described BCG is how you are going to describe each and every. For you to earn the 30% there, which is 30 marks, you need to make sure that you mention all other available vaccines. We have polio vaccine, we have inactivated polio, we have pentavalent vaccine, which is we call it DPT hip, which is diphtheria, pertussis, tetanus, Haemophilus, hepatitis B, and then we have Haemophilus influenza type B. Okay, we have other vaccines, of course. We have PCV, which is you don't have to write these in abbreviations. Okay, you need to write them in full. So these are what we call pneumococcal conjugate vaccine. This is PCV. You should know when it's given, intervals, and the dose and everything. Okay, even including the route. Okay, we have the measles vaccine. We have the yellow fever vaccine. We have also the current Zambian program has introduced what we call yellow fever vaccine. On the yellow fever vaccine, because not a lot have been said on the yellow fever vaccine. So I'm going to tell you some information on the yellow fever vaccine. So the yellow fever vaccine protects you against yellow fever and is given as let me follow the order here. So it protects against yellow fever, and the route is subcutaneous, and it is given at 9 months of age. And so I said one dose. So the interval there is new because you are going to only give this one dose. And the dose for this yellow fever vaccine is 0.5 milliliters. Okay, I said the route is subcutaneous. We also have human papillomavirus, which is given against the cervical cancer. It's given in 2 doses, most at the age of 13 years, and the interval is just 6 months. After you give at 13, then another 6 months, you give it just 2 doses. And it's given intramuscular on the deltoid muscle, either left or right. So if there is indication, you need to make sure that you mention it clearly if it is left or right. But on the human papillomavirus, is given on the deltoid muscle, either side. The dose still remains 0.5 milliliters. Okay. We also have the expanded program also includes meningitis A. So on the meningitis A, it's usually called Men A, and then we also have a vitamin A vaccine. Okay, so these are various vaccines that are currently in Zambia. You should find out more about the information that is here so that you earn the entire 30 marks. Okay, so now let's go to C, which is saying discuss in detail the specific nursing care of baby booster until discharge. Remember, before you even start intervening on baby booster, there are some specific parameters you should consider. How old the baby is. And you should also consider some other, what we call some other limitations of the baby. What a baby cannot do. Okay. So on the discuss in detail the specific nursing care. This is specifically on the nursing care. The next question that is going to come on the management, just made on general management. I'm going to teach you how to answer general management. Today we're going to discuss the nursing care. Okay, nursing care. So since I mentioned to say I'm going to teach you to how to manage the infectious disease and normal condition. So now let's first let me go on this side, and we are managing baby booster having tetanus. Okay, so is tetanus an infectious disease? Yes, it is an infectious disease. Okay, so even the management is going to change. Management is going to change. There's a difference between management of a normal condition and management of Ingira. So with the tetanus, usually this one I said it's an infectious disease. Okay, I said this is an infectious disease, so even the management is going to differ. So on the management of an infectious condition, the first thing that we start with is the patient isolation. Should note that patient isolation. Okay, so on the patient isolation, you want to isolate the patient. From the rest, because you don't want to cause what we call cross infection. Okay, you don't want to infect other available patients who are not having this particular infectious condition. And apart from that, you are doing this so that basically on infection prevention, there are a lot of things that you are going to consider, especially on patient isolation, because this is one of the principles of infection prevention. So you are also trying to make sure that whoever enters, you put this patient in a controlled room so that whoever enters that particular room is with a caution to say that this particular person is infected. Okay, so you are going to start explaining objectively as why you are isolating the patient from there, from everyone else. Put them or manage them in an isolated room. Okay, so apart from that, then you go on infection prevention. Okay, on infection prevention, you want to stress about the importance of infection prevention on this patient. Okay, infection prevention comes from various ways. So for example, I'll make sure that I sterilize the equipment before and after the procedure to prevent infections. I'll make sure that I wash my hands before and after the procedure to prevent infections, everything. Okay, I'll make sure that I wash my hands before I touch the booster, all those kind of things that you can explain. Okay, and then you go on disease notification. Since this is an infectious condition, so disease notification, as someone who is competent to work, you are supposed to do disease notification. So in disease notification, there are important people you can notify. It could be, we can start with the Ministry of Health so that they know about this particular condition. And then apart from that, you can also notify maybe the staffs in the ward so that they know about it. And even creating community awareness about this particular disease so that people are doing things with caution. And then you are going to talk on observation, observation of the patient. So that was infection prevention, and then upper disease notification. Okay, then you are going to observation. Observation, you just want to talk about maybe any observation that is done on the patient. Okay, for example, I'm going to take vitals to monitor the or to act as a baseline data for the condition of baby booster. I'm going to be taking the vitals of baby booster each and every 2 hours to monitor the condition. Okay, I'm going to take the heart rate to monitor the what is the function of the heart. Each and every observation that you are going to include here. Okay, and then you go on psychological care to the mother specifically, because baby booster is just 2 weeks and there is nothing that you can tell baby booster, so it's to the mother psychological care. So I'm going to explain the procedure to the I'm going to explain the disease to the mother so that to lay her anxiety. I'm going to explain to her that tetanus is an infectious disease, but with effective treatment, it can be treated. Everything, okay? I'm going to involve the booster's mother in a treatment to lay her anxiety. Okay, so that's on the psychological care or to the mother. Okay, then on the other point you can include is hygiene. Hygiene specifically goes to baby booster. Hygiene, what are you going to do on hygiene? Okay, so you are going to do baby bath to ensure that to maintain the high levels of hygiene on baby booster. It's also going to prevent some infections, right? Yeah. So in hygiene, I'm going to remove any swords, linen to keep the baby booster warm, and I'm going to change the napkins of the booster, okay, in case they are soiled. Then you are going to talk about nutrition. So this is where now the point comes in. When you go on nutrition, I mentioned to say depending on the age of a child is what you're going to talk about nutrition. On nutrition, you can't start talking about I'm going to give Shima to baby booster. Baby booster is just 2 weeks. So you're going to say this one is now basically about breastfeeding. I'm going to encourage the mother to baby booster to feed her more often. Okay, this is to make sure that she receives the nutrients for nutrient balance and the development to growth. Okay, it's also going to promote healing. So that is the nutrition, right? You are also going to talk about elimination. You're also going to talk about, so on elimination, I'm going to monitor the urine output as well as the bowel to ensure that the systems are working okay. Okay, then on medication, you are going to talk about I'm going to medicate to administer medication timely to baby booster so that they can what she can heal quickly. Okay, and then you can also add advice on discharge. Okay, so this you can just talk about to the mother about continued care even at home in case they go, and how to use medication and everything. So now the thing is, the recommended number of points on each subheading, like hygiene, you are supposed to write 5 points. Okay, 5 points on each. So you are going to write 5 points on each. 5 points under just one subheading. Then you go to nutrition, 5 points. You go to elimination, 5 points. this is Nmcz standard, and you are going to get the marks that you deserve. So let's just talk about the last question as well. So the last question says, identify 5 points you include in your IEC to the mother for baby booster on discharge. 5 points. You just want 5 points that you can include as IEC. So 5 points that you can include as IEC. You can talk about the importance of cord hygiene. You write importance of cord hygiene. Okay. So on the importance of cord hygiene, you want to explain some important stuffs. Okay. Like not using any kind of medication when you're cleaning the cord. Okay. Just use a clean cloth without any kind of ointment or anything. Okay. Use clean cloth to prevent infection of such kinds. So that is one, importance of cord care. And then two, you go to immunization awareness. Remember, baby booster is just 2 weeks old. So you also want to talk about immunization awareness. You want to teach the mother to baby booster about the importance of immunization to the baby. Okay, I think that is explanatory. And then you want to go to you want also to explain about the maternal immunization, right? So here we are going to specifically target the maternal tetanus immunization. So on the maternal tetanus immunization, we're just going to say, ensure that the mother next time she's going to conceive, that she receives maternal tetanus to prevent this spread of tetanus to the baby. Okay, so this is about the maternal tetanus immunization. Okay, and then the fourth one is about safe delivery practices. Safe delivery practices. On safe delivery practices, you want to talk about advising the mother conducting the birth to the hospital, okay, at the health facility, because there, even the method they are going to use equipments that are to the standard and so on. Okay, so this is basically it about the guidance in today's session. I hope you enjoyed, and don't forget to subscribe.